Didn't see you there.
Hi, I'm Mira.
And I'm Miranda, and welcome to Dental Diaries.
Today we have a toothacher topic. A toothacher is the same idea as a manicure, but for your smile.
Right, anything that has to do with the aesthetic improvements and maintenance to your teeth. And today, we're talking about brushing.
Today on this episode, we will be explaining the correct way to brush your teeth.
Most people don't know exactly how to brush their teeth to optimize their oral health.
That is why today we will be talking about not only the proper techniques, but the mistakes you could make while you brush your teeth.
It's important to talk about this topic to prevent extensive and expensive issues down the road from lack of hygiene or improper techniques. First, you should make sure that you're using the correct brush. If your gums are sensitive, you should get a toothbrush with extra soft bristles. Discuss with your dentist if an electric toothbrush or even a different type of toothbrush is better for you.
Also, make sure to replace your toothbrush about every 3 to 4 months. Most people hold on their toothbrush for much longer than recommended.
If the toothbrush is discolored or the bristles are bent, this is an indication that it is time to replace it.
A common misconception of toothbrushing is the harder you brush, the better you are brushing. It is not correct.
No. Plaque is loose and soft, therefore a gentle scrub is better to remove the plaque. Scrubbing teeth too hard will only damage the gum line, and if continued, can wear the enamel away.
Third, you need to think about how quickly you are brushing your teeth and how frequently. It is recommended that people brush twice a day for 2 minutes in the morning and at night.
It's easy to forget to brush your teeth in the morning, but leaving food on your teeth till dinner time dramatically increases your chance of getting cavities.
We're going to show you how to brush your teeth correctly. Brush your teeth in a circular motion near the back. Don't forget the gum line area. And don't forget the tongue. And before we finish up, we want to quickly talk about flossing.
Flossing every day is important for preventing gingivitis and long-term periodontal disease.
It doesn't matter what kind of floss you decide to choose, waxed or unwaxed, are both adequate options to floss. Wax typically helps patients to get a smoother glide when going from tooth to tooth.
Flossing regularly is important in prevention of gum disease, but also brushing cannot always reach the food or tartar in your teeth.
Did you know that the buildup of plaque and tartar increases risk of bone loss and tooth decay?
When left untreated, the tartar buildup can be visible on an X-ray,
which is alarming given that X-rays are only supposed to pick up hard tissue.
So essentially, so much tartar has been built up that it has calcified and continues to aid in the decay.
So it's important to floss to make sure you are reaching all the grooves between your teeth and you're not leaving any tartar and plaque behind.
Thank you so much for joining us this week on Dental Diaries.
Please join us next week when we're going to be covering dental care products.
Bye!
Bye!